Hi everyone, welcome and thank you for joining us for today's ASA web seminar, The Ethics of Working with Older Adults, which is part of the Family Caregiver Support Series sponsored by Homestead Senior Care. We'll be getting started shortly. The slides for this presentation are available on a tab on your screen marked Resources, and under the tab marked CE Application here, you'll find information on how to obtain CE credit for this event. You'll have 60 days to complete a continuing education application, and it may take up to 30 days from the date of your application in order for us to process and issue your CE credit. If you are not logged in directly to this web seminar, that is if you were watching as part of a group and did not log in using an individual confirmation URL, you will not be eligible for continuing education credit because we have no way to track your online attendance. If you would like to receive CE credit, please be sure you log in using the confirmation URL you received after individually registering. If you have questions during the presentation, you can send those at any time using the questions box on your screen, and we'll save those for the last 10 to 15 minutes of the presentation. And now I'd like to welcome Lakeland Hogan. Lakeland is a gerontologist and caregiver advocate for Homestead Senior Care and a doctoral candidate at the University of Nebraska-Omaha studying social gerontology. Welcome, Lakeland.
Thank you so much, Betsy. Hello, everyone. Thank you so much for joining me today. As professionals in the aging service sector, it's really important to recognize the ethical issues that could arise when working with older adults. So again, I'm so grateful that you are here to talk with me today about this topic. It is very important. Some of it might be a review for some of you, but I hope that it will give you some food for thought and help just reinforce the ethical principles that we should be following as professionals when we are working with the older adult population. And there are a multitude of areas in which these ethical issues can emerge, including complex family dynamics, addressing end-of-life wishes, preserving dignity and respect, promoting independence, and keeping the individual safe. And these various factors, there are various factors that can make older adults vulnerable to things such as abuse and neglect and ill intent. However, again, these ethical principles can guide us as we handle these ethical issues and by helping us better understand these issues, we can hopefully help reduce the risk of harm and advocate for the older adults that we work with, and also report those issues to authorities when necessary. So I'll start by just overviewing our objectives here on the next slide. So we'll begin with a review of the ethical principles. We'll talk about them in relation to caregiving, but also into the various professions that we all work in. But all in all, we'll be looking at them through a lens of working with older adults. And then I'll be talking about common ethical issues and discuss prevention of abuse and neglect. We know that, unfortunately, abuse and neglect is a somewhat common ethical issue when working with older adults. However, it's not the only ethical consideration that I'll go over today, so I'll also cover some other ethical issues and topics. I'll also discuss how we can support an older adult or family caregiver in decision-making and helping, again, to preserve their independence and dignity. And finally, I'm going to walk you through an educational ethical decision-making model and offer up tips and resources. And before I go too much farther into this presentation, I do want to give a special thanks to Dr. Beverly Crocker. She's a professor of business ethics at Creighton University and founder of the Business Ethics Alliance, and she really provided me with some valuable information and insight as I was putting together this presentation, including her ethical decision-making model that I'll be sharing with you all in just a bit. So let's start with a review of what ethics is. When we work with older adults, it's really important to treat them with dignity and respect. And you're going to hear me use those terms a lot through today's presentation, but it is really our goal as professionals. And ethics is really honoring the rights and dignity of all people, and especially in the field that we are in, honoring the rights and dignity of older adults. So formally defined, ethics is a system of moral values or a set of principles of conscious conduct And it's really doing the right thing and honoring someone's decisions. And most of the time, it's easy for us to do the right thing. But from time to time, issues might arise that create challenging situations or ethical considerations that are needed. Many professionals, especially the healthcare profession, have a code of ethics. And for many of us, this is something that's really drilled into us as we're going through our training. However, many family caregivers may struggle with ethical decision-making when it comes to the care of their aging loved ones. They might not know of some of the attributes that make an older adult vulnerable, or they might not realize the impact that some of their decisions might have on the older adult that they're caring for. So again, what ethics boils down to is really doing the right thing. And sometimes there are laws in place that really help to guide those ethical decision-making efforts. And as part of the Patient Protection and Affordable Care Act that was enacted in 2010, part of that was the Elder Justice Act. And it was the first piece of federal legislation passed to authorize a specific source of federal funds to address elder abuse, neglect, and exploitation. And this is really an important ethical consideration when working with older adults. This was the first comprehensive legislation to address elder abuse here in the U.S. And this act authorized the first federal funding provided to state and local adult protective service programs. And it also provided additional support to long-term care ombudsman programs. And these programs work to resolve problems related to health, safety, the welfare and rights of individuals who live in long-term care facilities, such as nursing homes or assisted livings or other types of residential care communities. And the Ombudsman program helps to promote policies and consumer protections to improve long-term care services in facilities at the local, state, and national levels. And while laws are important, I do want to make the distinction between law and ethics. The law is the minimum that we must do to protect older adults, and ethics should really be the maximum. So an ethical person follows the law, but is also guided by higher principles. An ethical person does the noble and right thing and bases their actions and decision-making on values. So again, it's so important when working with older adults to be aware, of course, of the laws, but also to have these ethical principles in mind, because we know, again, that there are many attributes of aging that can make an older adult vulnerable. So I want to go over those attributes with you all. One of the reasons I love working with the older adult population is it is a group of diverse and vibrant individuals. They've lived various life experiences, and they still have so much to give to our society. And while they are very diverse, there are some common attributes that can increase a person's vulnerability as they age. So it's important for us as professionals to be aware of these vulnerabilities and for us to educate family caregivers on them. There are many attributes listed here on the screen, and so I do want to highlight a few of them. Of course, isolation and loneliness, especially during this pandemic that we're all experiencing, is a big concern. Isolation and loneliness can lead to a variety of physical and mental health issues that can make a senior more vulnerable. The health status and physical decline of an individual can also make them vulnerable. It might limit their activity and their mobility, and it may also increase their need for care and support and their reliance on others. Cognitive impairment can make an individual more vulnerable, and some of those early signs of cognitive impairment are poor judgment, and that could really leave an individual in a vulnerable situation. And if the individual's cognitive impairment evolves to dementia or Alzheimer's, they eventually, over time, will lose the ability to care for themselves and become more dependent on others. That can increase their vulnerability. Social supports are also an area where someone could be vulnerable. As I just mentioned, sometimes there is need for more assistance, and for those whose family members jump in to provide care, it might be a large task for them to take on. They might not fully understand the role and responsibility or know where to go for care and support. And so that could end up leaving the senior to be more vulnerable. We know financial security and socioeconomic status can leave an individual vulnerable, especially if they lack financial security in their older age. And those who are living on a very small income, or those who are living in poverty, they might not have access to services and support, again, leaving them vulnerable. We know there are also environmental factors. Where they live, the environment they live in can make them vulnerable. If they're living in an institutionalized or facility setting, it can also cause vulnerabilities. I know during this pandemic, these institutions and these facilities, these care communities are really challenged with balancing the safety of their residents along with the social support and interaction. So that is certainly something that is a big challenge in the care continuum at this point in our history. And also, older adults are less likely to report abuse, and this could happen for a variety of reasons, and that could make them more vulnerable. They might be dependent on their abuser for their care, and they might be hesitant to report for that reason. They might also be embarrassed by the abuse or fraud. There's a lot of embarrassment that comes along with fraud, and so they might not report that it is happening, or they might feel that it's a threat to their own independence. So for this long list of reasons, and I'm sure I've left off some, there are attributes that make older adults more vulnerable. So that's why it's so important that these ethical principles really guide our decision-making and the care that we provide to the older adults that we work with. And before I go over these definitions, I just want to note that the terminology around ethics might vary from profession to profession, and terms really don't matter as much as the meanings behind the terms. Again, those meanings should really guide our actions. So the ethical principles on the slide were first introduced by Buchanan and Childress in the late 70s, and they identified 4 principles that are at the core of ethical reasoning. These happen to be specific to healthcare, but again, the terms might vary from profession to profession. So we have autonomy, justice, beneficence, and non-maleficence. And then in the 80s, Kitchener added a 5th principle, and Kitchener came from the world of counseling and added fidelity to that list. And what I like about adding fidelity is, as professionals, we might not necessarily identify with fidelity, but certainly family caregivers can identify with that. So the first ethical principle is autonomy, and that principle is addressing the respect for independence and self-determination. And the essence of this principle is really allowing the individual the freedom of choice and action. The next is justice, which seeks the sharing of benefits and burdens based on fairness and equality. Beneficence is, simply stated, is to do good, to be proactive, and also to prevent harm when possible. And non-maleficence is the concept of not harming others, often explained as above all, do no harm. And then fidelity, the last one, again, it depends on your profession, but I think especially for family caregivers, this principle involves notions of loyalty, faithfulness, and honoring of commitments. So when any of these or all of these principles are overlooked, this is when a person might be at risk for harm, for neglect, or abuse. So we really do want these ethical principles to drive our actions and to drive our decision-making in our roles as professionals in the aging space. And there are several ways of driving these ethical principles in terms of the way we use them. So these ethical principles are really embedded in our professional, organizational, and family cultures, and they can be broken down into 2 categories of formal and informal. So the formal dimensions of culture, these would be things such as policies, codes of ethics, that's especially important for the medical field, or value statements, rules and regulations, the Bill of Rights for our patients or clients, and so forth. It also involves processes like how we report or how we provide care. And for those that have a license or certification, it could involve your ethical review board or a standards review. And these formal dimensions are often written down and planned out. So again, hence the term formal. They're a very formal part of our profession, our organization, and our family cultures. And then there's the informal dimensions of culture. And these are more of the norms of how people actually do things. In your place of business, you might have a policy, but at the water cooler, you might hear people say, well, yeah, that policy is in place, but this is how we actually do things. So those would be those formal dimensions of culture. They're observed behaviors. They're the storytelling. And they're often unwritten or spontaneous. So I want you to just pause here quickly and think to yourself, what are the formal and informal dimensions of culture in your place of work? And then how do they drive these ethical principles? I know in our work at Home Instead, we have a number of these more formal dimensions of culture that really drive our ethical principles, and we have a number of informal dimensions of culture that I can think of. But as I mentioned earlier, a Bill of Rights is pretty typical for any service provider, healthcare provider working with an aging population. And a Bill of Rights, again, is an example of a formal driver of these ethical principles. It might look different if you look at a hospital's Bill of Rights versus a facility's, or if you run a counseling practice versus an elder law office, but generally the same principles apply. You can read this Bill of Rights. It comes from the Arizona Direct Care Curriculum Project, but a few of these principles I want to point out. You can see here it says they have the right to design their own treatment plan, to refuse treatment, the right to privacy. So again, those ethical principles really shine through this more formal Bill of Rights. And as professionals, we have these formal and informal drivers of ethical principles, but now I want us to pause for a moment and consider from a family caregiver perspective. There are often very few formal dimensions that drive ethical principles for caregivers. They're far more likely to have informal drivers of these ethical principles, but some might not have those informal drivers. They may have never provided care for someone before, or they might have watched their mom or grandma care for someone. So that's why they often look to us as professionals for guidance and support when it comes to these ethical principles. So again, we have to kind of think of it in two buckets of, us as professionals and our ethical principles that guide us, and then we need to think of it a little bit differently from the family caregiver perspective. The principles are all the same, but those family caregivers might just need a little extra support and guidance. So I touched on a couple of the common ethical issues that we see when working with older adults. And I would say that kind of the one overarching ethical challenge when working with older adults involves the ethical principle of autonomy, the right to be able to make their own decisions about their own care. As adults, we often take advantage of our own autonomy and the right to make our own decisions. And older adults, as we age, I know for myself personally, I want to be able to continue to make my own decisions as I age. So older adults still want that autonomy, and they really don't want others making decisions on their behalf. They still want to be able to do things like to vote or open up their own mail or to be the keeper of their medical records or have a say in their plan of care. They want to participate in that decision making and have some control over aspects of their life. And if they have to make a move or they have to decide on a plan of treatment, they want to be involved in those decisions. So again, that kind of overarching ethical issue is autonomy, but it can trickle down to all of these bullets that I have here on the screen. And I'm going to dive deeper into some of these topics, but for those that I don't dive deeper in, I just want to touch on here briefly. So the first is ageism, and you might not think that this is really an ethical issue, but ageism occurs in a variety of environments. It can manifest during medical care. When a medical provider is deciding on the aggressiveness of a treatment based on the age of the patient, they might not opt for as aggressive of a treatment. Or in a facility setting. An older adult might not be encouraged to engage in as much physical activity because there might be some ageism that individual, the activity might be too much for them. So these misconceptions of ageism can lead to some challenging ethical decision makings. It could lead to misdiagnosis. It could really result in poor treatment outcomes. So we really do need to look at our profession and our lens of ageism. I know many of us are in this profession because we love working with older adults and we want to reduce the stigma of ageism. And so I think that's an important ethical consideration for us all to consider from all points of view. Another could be bias and discrimination. It's important to consider how bias and discrimination can impact ethical decision making, specifically in the areas of racial discrimination and sexual orientation. And what I failed to also list on there was gender discrimination. So these types of bias and discrimination could result in allocation of resources or the designing of support systems. So we do need to have that ethical issue in mind when we're making decisions. Also, personal privacy. I might have touched on this a bit already, but it's especially important for older adults that their personal privacy is maintained as much as possible. I hear this when I hear complaints about personal privacy from older adults that live in a care community or that have professional caregivers in the home from time to time, where they feel that their personal privacy is not being taken into consideration. They might, instead of knocking on the door, just come right in without really announcing themselves. So it's important that we have personal privacy in mind as an ethical issue. And then grievances and complaints. Older adults, as I mentioned earlier, might be less likely to express those complaints because of fear that they'll be treated differently, especially if they're relying on a care provider. But it's important for older adults to have the right to express those grievances without fear of retribution. So again, I'm going to go deeper into some of these areas here in the coming slides, but I did want to touch on just a couple of those quickly. And I want to start by diving deeper into capacity and competency. Often there's confusion between these two terms, and it's important to understand because a person's ability to make decisions can influence decision-making in a lot of ethical situations. So capacity is the ability to make decisions. Capacity is a fluid concept. An individual may have capacity at one moment, but lack capacity in another moment. And when we work with the older adult aging population, and especially those with cognitive impairment, a person's capacity might change, or especially if it's Alzheimer's or a dementia where it's a progressive form of cognitive impairment, their capacity is going to change throughout the disease course. So it's an important term to understand. And then competency is the ability to perform actions needed to put a decision into effect. And competency is really a legal term. And we often talk a lot about the opposite of competency, the word incompetency, which is the lack of ability to understand decision making, such as healthcare decision or financial decisions. So I have another slide on this topic just to provide a little more insight. So people sometimes assume that capacity is an all or nothing type of ability. Either you have capacity or you don't. And sometimes it's framed as whether a person is competent or incompetent to manage their own affairs. But the reality is it is pretty complex. It's important to understand that capacity is decision specific. This means that a person's capacity should be evaluated in light of the specific decision being made. And it really can fluctuate on the circumstances. If you think about it, a person's ability to make a decision on what they want to eat for breakfast is very different than their capacity if they have cognitive impairment to make financial decisions on their own behalf. So again, it's very decision specific. And generally, capacity requires that the individual is able to understand the situation that they're in, understand the decision in the question and decision, and then also the consequences of making a given choice. So I thought I would give a little example to show how how capacity can change. So immediately after a surgery, you might feel drowsy, you might feel a little out of it. And in that state, you might have the capacity to make a simple decision, but should a more complex medical decision have to be made, you might not have the capacity in that moment to make that decision. But as you recover from the surgery and as you come out of the grogginess of the anesthesia, you're going to regain your capacity in most circumstances. So again, capacity is specific to the situation and to the decision. But again, as I mentioned in dementia, it is really important when we talk about planning for those that are diagnosed with a form of cognitive impairment or dementia, that documents and planning take place towards the beginning of the disease or right after diagnosis while the person still has capacity, because as we know with a dementia diagnosis, the individual is going to lose the ability to make some of those important decisions over time, especially in the areas of health and finance. So we need families to understand that if their loved one has some sort of cognitive impairment, these issues of capacity and competency might come up as ethical issues that the family has to face. And then one final note on this topic is informed consent. And this involves adequately informing an individual about the treatment or services that are being provided. And in order to provide informed consent, you do have to have the capacity. Okay, so the next topic that I'm going to cover is confidentiality and personal boundaries. Most professionals have an obligation to keep confidentiality. An ethical principle of autonomy really requires confidentiality. There are laws in place to protect the confidentiality, especially of health information. We all know of HIPAA and PHI, private health information, and there are regulatory guidelines around this. I know with the pandemic, the current state that we are in, COVID and can be a challenge when it comes to HIPAA. It can be tempting to share that an individual has been diagnosed with COVID without that person's consent. But again, we need to keep in mind of the HIPAA laws and regulations and get consent from the individual to share that information. Of course, there are some mandatory reporting that those individuals that are diagnosed have to do with those who have been in contact with them within a certain time range. I understand that. But again, these types of issues do come up from time to time, and it's important as professionals that we maintain confidentiality. However, there is a time when it is acceptable to break that confidentiality, and that is because most healthcare professionals are mandatory reporters. So if they know about abuse or impaired decision-making capacity, they might have to break that confidentiality because of that mandatory reporting requirement. It's also really important to remain professional in our relationships. I know, again, a lot of us are in this business or in this field or profession because we love working with older adults and we make connections with them and their family caregivers. We're passionate about the work that we do. And it is important to build a rapport with those that we work with, to build trust. But it's important to do so while still respecting the boundaries of that personal relationship. And it doesn't mean that we can't be friendly or show compassion or support, but it is really important for maintaining that professional relationship. And this even includes when our own friends are in our care. If we are providing care to a friend, we still need to treat the care within that context in a professional relationship. And I know in home care at Home Instead, our professional caregivers often become like family members. They really spend a lot of time with those that we serve. And so those professional boundaries, it's easy for them to get a little blurred, but we always reinforce very strongly in training that those professional boundaries need to be in place. And I found a quote that kind of sums up this topic. It says, "Our professional relationships are forged in service of our professional goals. whereas our personal relationships arise out of basic human need for love, connection, and belonging. So of course, we want to have personal relationships, we want to have professional relationships, and it's important, again, to make sure that those boundaries are established. So the next area for ethical consideration is elder abuse. Elder abuse is an important ethical issue, and it seems to get covered a lot. So I don't want to spend too much time on this topic, but we do know that the prevalence of elder abuse is about 10% of the aging population. And that includes the types of abuse that are listed on the screen. So I'm not going to go into each of these specifically, but they unfortunately do occur within the work that we do. I know I have seen some instances of abuse where I've had to report to Adult Protective Services. And I know that financial abuse seems to be, unfortunately, something that is occurring within the older adult population more than we would like. And that also goes into the topic of fraud. I've done an entire presentation just on that topic alone. I could talk about it for quite some time. But then we also know that neglect is a form of elder abuse. And I do want to go over the types of neglect. So we have the physical, emotional neglect. We have abandonment when the individual has a caregiver and they're no longer upholding their caregiving responsibilities or duties. There's financial neglect, and then self-neglect. And I thought that the term self-neglect was interesting, so I wanted to just go a little deeper into that because I feel like that might not be covered as often as some of the other topics. So self-neglect happens when a senior fails to meet their own essential needs, their physical, psychological, and social needs, to a point where it threatens their health, safety, and well-being. So this includes the failure to provide adequate food, clothing, shelter, and health care for one's own needs. And unfortunately, sometimes self-neglect might not be a personal choice. It might be the result of financial inability or the physical inability to meet their own personal needs. And so when we think about self-neglect, there are some signs that we can look for. Malnutrition, extreme inappropriate clothing that might be too big or too small, or a marked decline in their personal appearance without any sort of explanation. It might be a sign that they're no longer able to keep up with their own needs. Untreated medical conditions, unsafe or unsanitary living conditions, unpaid bills or utility disconnects might be a sign, and then notable decline in their own personal hygiene. And this really becomes a problem when the person lacks the ability to understand, even with support, the impact of the choices that they're making. It also is a problem with self-neglect. Neglect creates serious risk of harm to themselves or others. And those who neglect themselves are also more likely to suffer from the abuse of another person. So again, self-neglect is not something to take lightly, any type of neglect or abuse. And again, many of us in our professions are mandatory reporters. So I found a checklist that might be helpful for us as professionals to know when it is time to report abuse or neglect. So this comes from the National Adult Protective Service Association, and you can read that the necessary action to take is to either call 911 or to call the local Adult Protective Services when you see the following on the screen. And again, I won't read it word for word, but this can be handy if you've downloaded the slides to keep this on hand and to share with family caregivers for educational purposes. And I know that when we think about ethical principles, we often think about dealing with the ethical issues, but there's so much that we can do to be proactive in the ethical approaches that we take. So when it comes to elder abuse, there are a number of things we can do to prevent it. So first, of course, is to be aware of the risks of abuse And again, this points to the ethical principle of doing no harm and preventing harm from seniors. So if we're able to be aware of the risks and learn the signs, if we can help to prevent isolation. Earlier I shared with you that isolation can lead to some vulnerabilities for an older adult. So if we can prevent isolation and make sure that the individual has regular interactions with others, can really help to not only keep an eye out for signs that something is going on, and also can prevent, hopefully, abuse and neglect. Also, providing respite breaks for caregivers. When you think about it, caregiving can be very overwhelming, but having time away for the caregiver to be refreshed and to get some respite can really leave them with kind of a renewed energy for their caregiving role. They can come back to their caregiving responsibilities refreshed. And sometimes caregivers, they could get to a point where caregiving becomes overwhelming and they might have to make some really tough decisions. And so we can come along these caregivers and support them along the way. Hopefully we can help them through some of these ethical decision-making scenarios to prevent things like elder abuse and neglect. We can also educate them on fraud prevention. As I mentioned earlier, fraud amongst the aging population is very prevalent. And then also reporting abuse will hopefully help to ensure that it will not happen in the future. And then also raising awareness. There is a World Elder Abuse Awareness Day. It happens in June. So that might be a good way within your community or your organization to promote education on this topic. Another important area for ethical consideration revolves around the support for care decisions. Supporting an elder's care decision or end-of-life decision is driven by the ethical principle of autonomy and allows for the senior to participate in the decision-making. So it's important for us as professionals and for family caregivers to regard and protect an older adult's choice for things such as ongoing care, the discontinuing of treatment. That would be something such as not deciding to pursue treatment for cancer or for kidney failure, life-sustaining interventions. If they're making a decision not to engage in those life-sustaining interventions, we need to support that decision. Do not resuscitate orders, and again, those end-of-life decisions. And then there's this term dignity of risk. And I heard this a few years ago, and it really helped to put a term to something that I think so many people struggle with. So the dignity of risk is the right to take a reasonable risk, but still allow people to have dignity and self-esteem. So really, this is the struggle of balancing autonomy and beneficence and non-maleficence. We want to give older adults autonomy to make their own decisions, but we also want to do what's best for them and keep them safe. And this can be especially hard for caregivers. They oftentimes want to be excessively cautious for their loved one. They want to do what's best for them, but oftentimes they don't allow for the person they're caring for to participate in the decision making. A lot of times I see this term dignity of risk come in conversations about fall risks. A adult child, their parent has been falling or had some near falls, and they've wanted to get help into the home, but the parent has refused. They've wanted to make some home modifications, but the parents have refused. And the children are kind of at their wits' end. They don't know what else to do, and they end up just kind of waiting for a fall or something, an accident to happen to really be able to have a true conversation with their loved one. And they're really trying to balance that risk and the dignity of their loved one. It's such a common issue that we see when we work with older adults. So again, it's really important that we support care decisions. And there are times when decisions will need to be made on the behalf of the aging adult. Again, if they lack the capacity or competency, but if we can support them in their care decisions, or at least hear them out and listen to their care decisions or their wants and wishes, hopefully that can help influence the decision making. And dementia, that is another area where a lot of ethical issues arise. People living with dementia, they still have thoughts and feelings. They can still contribute in meaningful ways. Our care and support of those living with dementia needs to find that balance of autonomy and beneficence and really essentially just do good for the person. As dementia progresses, the person may not have, again, the capacity to make decisions or informed choices. However, the person may also find it distressing to be ignored in areas that they're still capable. So we really need to think through the decision, can the person contribute? And there's some questions we can ask ourselves. Can they make a reasonable and informed decision? Will it cause harm to their self or others? This comes up a lot when we talk about driving in dementia or wandering in dementia. Those in the early stages of dementia, they might still be able to drive for a period of time, but it might come to a point when they're harming themselves or others, and that might be a time to have that definitely is time to have a conversation with the individual about driving. Or wandering. Can we create a safe environment for the person to wander so that they're not harming themselves or others? Another question to ask is, can the person understand the risks and the benefits? And is there consistency across time? For example, before the individual had the diagnosis of dementia, did they express wishes? Maybe it's that they don't want life-sustaining support if it came down to it, or they've always expressed that they've wanted to stay in their own home as long as possible. Has there been consistency over time? And again, we want to be very slow to ignore the individual's capabilities. Oftentimes I see family caregivers wanting to jump in and take over just because it's faster if the caregiver does it. It takes the person living with dementia too long. But if we can still enforce those capabilities that they have, hopefully they can hang on to those abilities, and it also can help provide the individual with that sense of autonomy, that sense of independence, that they're still able to contribute to their care, their activities of daily living, or whatnot. And often an ethical consideration comes about when families have that conflicted feeling of keeping their loved one at home or moving them to a facility or changing their environment. And those are situations where we really need to weigh the benefits and the risks. So again, when we're working with individuals living with dementia, it's finding that balance of autonomy and beneficence. So when we are faced with these ethical decisions, there are a few ethical decision-making models that I wanted to share with you today. The first model is developed by Dr. Beverly Crocker. She put together this ethical decision-making model, and I love that she has broken it down into these 4 steps. So the first is to really understand the dilemma. What is the ethical issue that you are facing? And then what are the facts of the situation? And who are all the stakeholders involved? And who will be affected by the decision that's made? And then step 2, imagine the options. When you first think about it, what are the black and the white options? But then give a little more thought and think outside of the box. I think when, especially you're working with an individual with cognitive impairment, that second thought, thinking outside the box and getting creative can really help provide some unique solutions to these ethical decisions that have to be made. And then think through the options. I like how this model shows think far, think wide, and think high. So think far, what is in it for me? What are the options that do the greatest good? Think wide, what are the legal and professional organizational responsibilities, what are required there, and what is fair, that principle of justice. And then also think high, what are the aspirations of the people in the organization involved? And of the options, which would you be the most proud of, or which would you be embarrassed by? Kind of that newspaper test. Would you want it published in the newspaper? And then finally, decide the right thing to do and why. And if you want to learn more about this model, the Business Ethics Alliance, I'll share their website towards the end, but they have some great information out there. This next model is a little more healthcare centric. You might have seen this before, and this model is by Foster, Miller, and Davis. And it's very similar to the last model that I just shared. And what's a little unique is in step 6, they have these 3 simple tests to ensure they're appropriate. And I know that these tests were covered in the last model, but it does break it down here into these 3 questions. Would I treat others the same in this situation? Would I want my behavior reported in the press, that newspaper test, the publicity test? And then universality. Could I recommend the same course of action to another person in the same situation? So these 2 models can really help us as professionals and even family caregivers walk through these ethical decisions and hopefully make the best decision based on the information that we have in the situation that we're in. So some additional tips for professionals when you're thinking through ethical decision making. Inquire about your organization's ethical practices. Likely you are well informed on these at orientation, but sometimes we need that reminder when we're actually in an ethical situation that requires us to fall back on the organization's formal policies and that sort of thing. We also should be reviewing our profession's code of ethics regularly and refresh ourselves on our Bill of Rights, whether it's patient, client, or resident Bill of Rights. And then also staying up to date on local and national laws and regulations for our profession and industry is very important. And then engaging in these decision-making models, and of course, reporting any abuse or neglect. And then for family caregivers, we can of course, encourage them to learn the signs of abuse and educate them about fraud prevention. We can encourage them to plan ahead and discuss their loved one's wishes. And not only to discuss, what you want, tomorrow and next week, but also what would you like years down the road. And I always encourage families to talk about, their plan A, plan B, and plan C. In an ideal world, what would the individual want for their care, support? And if that's not possible, what would be the second best option? That way families are having these discussions far before the ethical situation arises. I'm sure you see it in your profession regularly, but often families don't think about these things until they're in crisis mode. And oftentimes it might be too late to have the discussion with the individual that is needing care or medical support. Or they might have progressed too far into a disease process such as dementia for the documents that are needed to be put in place. So it's important to get those documents in place, those power of attorney for healthcare and for finance. And for families, it can be helpful to seek professional help. An elder law attorney is a great place to start. And a lot of communities have also some free or reduced legal services to help seniors and their families get important documents put into place. So hopefully these tips are ones that we can pass along to those family caregivers that we work with. There's really no avoiding ethical issues. Many of them that we have discussed today will come up for us as we go through our professional lives. It might even impact us personally too as we care for our own aging loved ones, but we can equip ourselves and we can equip the family caregivers that we work with tools and resources to enhance the quality of life of the aging adults that we serve. Because when we get the ethics right, it really does make all the difference. We can support the autonomy and the decision-making of the older adults that we serve. We can seek justice for the elders in our care and our oversight. We can do good on behalf of the individual and aim to protect their safety, reduce the amount of harm, and we can show our loyalty, faithfulness, honor our commitments to the care that we're providing them. So these ethical concepts really help us to be better service providers, to be better healthcare workers, to be better family members and friends. So again, I don't want to end on a doom and gloom note because the ethics that we are guided by really do help us provide the best care possible to those that we serve. So I do want to leave you with some resources. And of course, you can keep the slides, you can download the slides for this presentation and refer back to these recommended resources. We have the National Center of Elder Abuse. USC has a Center on Elder Mistreatment. That's where you can find information on World Elder Abuse Day in June, so you can plan ahead for next year. Of course, Adult Protective Services in your local area, knowing the number and the contact information for that organization is very important. Also knowing your local long-term care ombudsman resources. You can visit the website there. And for care and support, and also to get connected to your local APS and long-term care ombudsman, your area agency on aging is a great place to start. And so you can reach out to them. I also mentioned the Business Ethics Alliance has some great resources. And again, I want to thank them for helping to inform my presentation today. And if you're joining us from Canada, there's a Center for Ethics and Corporate Policy that you can visit. And then if you're looking for an elder law attorney to send along to a family caregiver that you're working with, there's the National Academy of Elder Law Attorneys where you can search for the local attorney in your area. So this is a great list of resources to start with, and if you're listening and have any additional resources that you want to share, please add those into the question box, and I'll hopefully get to as many of the questions and comments as we have for today. But I just want to thank you all so much for joining me on this important topic. Feel free to reach out to me directly if you have any questions. But with that, Betsy, I'll turn it back to you for some questions.
Great, thanks, Lakeland. We have several really great questions that have come in. The first one is asking how you handle it when various family members might disagree on a patient's plan of care.
That is a big challenge in our industry. When we actually at Home Instead created this public education program all around family dynamics. And so I can share that resource out to the group because we do know that family dynamics can be where a lot of these ethical issues arise. So when family members are conflicted on the plan of care for their loved one, of course it's important to understand, does the older adult have capacity or competency to have say in their plan of care, because at the end of the day, that plan of care is for them. And if they do not, it's important to understand, is there a healthcare power of attorney in place? And that individual may have, a more final say in the plan of care. However, it's really important to consider what is best for the individual. And sometimes it's helpful to understand why people see a difference in perspective on the parent's plan of care. Sometimes it could be a deep-rooted sibling rivalry that is kind of rearing its ugly head, and or it could be, some general concern for their loved one. And so trying to get to kind of the root of, okay, I understand you don't agree with the plan of care. Can you help me understand why? To really get to the reasoning behind why those family members are having this disagreement. And without knowing more details, it's really hard to help in this situation. But again, walking through those ethical decision-making models, even in those kinds of situations where families are struggling, really understanding the dilemma or the question of the care. What are the options, and who is this going to impact? Maybe one family member is concerned about, if they go down this treatment path, they're going to require a lot of care and support, and our family just can't be there for that individual. So thinking through all the options, thinking far, wide, and high, as Dr. Crocker's model showed, and then trying to come to the best decision for the individual will hopefully be helpful. So thank you so much for that question.
That's great advice. Thanks so much, Lakeland. A lot of the questions we're getting really get at balancing some of these ethical principles. And this one is asking how we can balance the dignity of risk while also promoting patient and client safety. They're saying that many times the facility will not discharge a patient home alone. They're at high fall risk, but the patient wants to go home.
Man, that is a huge challenge and struggle. And I think, honestly, when I talk about, family dynamics and dignity of risk, falls is usually always the topic of conversation. And it is so hard to really balance that. At the end of the day, we as healthcare providers, we want to send someone home knowing that they are safe and they're not going to return to the hospital. And for many healthcare systems, the reasoning behind that is readmission rates. They really want to ensure that for various reasons that the patients they send home aren't readmitted. So I would say, in those situations, really understanding, who's available to provide support and what about the environment is unsafe? Are there modifications that can be made to the home? Can services be brought in if there's not a family member already? I know a lot of times a home care service like Home Instead will accompany a person home and the family will agree, okay, we'll have them in for 2 weeks. Sometimes if you kind of put a little time limit on it, it seems less limiting to their independence. If you say, okay, let's try it out for 2 weeks just to get you home and situated, and then we can reevaluate at the end of the 2 weeks and see if that's made a difference. Sometimes taking an approach of that nature can be helpful. But again, that is a struggle, is trying to balance the autonomy, but really also helping the older adult understand the consequences of another fall. Sometimes when we talk with older adults, we're actually going to be doing an entire presentation on fall prevention in October, so I hope you'll join us for that. I'm sure that presentation will give even more great insight and information. But helping them really understand what a fall could mean. Coming back to the hospital, it could mean that if you go home and have a fall, it could increase the possibility that you might not be able to remain in your home. So what are some things that we can do to really help make the environment safe, to really instead of limit your independence by having care and support at home or having family members come and check in on you to prevent falls, it's really helping to enhance your independence, helping you stay home longer. So sometimes it can be just a kind of a switch. I don't want to say reverse psychology because I don't believe that it is. I think it truly is helping to enhance the independence of the individual if they can live in an environment that can help to decrease falls. So that's a great question and one that we see often. So hopefully you can tune into our fall prevention webinar in a couple months and learn even more.
Great. And we have had a couple questions that come in about self-neglect. I think that's definitely a tricky issue. And this one question in particular says they have a number of clients who fit the category for self-neglect, but APS says that they're decisional and that it's a choice that they make. And so they're asking how they can help if that's the case.
Yes. Oh gosh, that's a tough situation. And I know Adult Protective Services in so many communities is overwhelmed with a lot of reportings and they have very large caseloads. And so it can be understandable when you go to report something like that and they have to or they determine that, they have, free will and choice on their own. So I think our local area agencies on aging are a great resource to our communities. And you can, at n4a.org, you can type in your zip code and find the local area agency on aging nearest you to hopefully help get supports into the home. A lot of times, we can start with something small to help support them, like a Meals on Wheels, or having someone come into the home to help with some light housekeeping, or encouraging eating at mealtime. So it is such a challenging situation and topic, and I think that if we can connect them to community supports through the Area Agency on Aging, or their local faith-based community or volunteer programs, to get some support and resources to them, hopefully that can help with those areas of self-neglect. Because as I covered, there's various areas of self-neglect. So maybe kind of prioritizing what that individual needs help with the most, and then finding a resource for that first can be a good place to start. So thank you for that question.
Great, and it looks like we have run out of time, so sorry we couldn't get to all the questions. But as you can see, Lakeland has her email address up here, and you can also reach out to ASA if there are other questions that we can help answer. Lakeland, thank you so much for this presentation. It was very interesting, and I think we all learned a lot.
Well, thank you so much, Betsy, and thanks to everyone for tuning in. We hope to see you again next month, and have a great rest of the day. Bye.
As Lakeland mentioned, the next presentation in the Family Caregiver Support Series will be on September 2nd, and you can get more information and register on our website at www.asaging.org. If you'd like to claim CEUs for today's web seminar, you will receive a follow-up email by the end of the business day that will contain a link to the CEU application. That email will also contain a link to download today's slides. Please note that you'll have 60 days to claim CEUs for this event, and it will take 30 days from the date of your submission in order for us to process and issue your CE credit. Thank you so much for joining us today, everyone. Have a great rest of your day.